A 62-year-old man presented to the physician's clinic with a sudden onset of neck pain radiating to the forearm for the past 1 day. Okay, he has a neck pain and the pain radiated to the forearm. He had been feeling a dull pain in the left upper back since playing golf 2 days earlier. Left upper back is nothing but deltoid. The physician left upper back since playing golf 2 days earlier. The physician orders an MRI that reveals the cervical nerve root mass. Which of the following might be affected if the nerve root affected was C8? Okay. For this we need to know the concept and the areas which are supplied by the nerves which is arising from C8. What are the nerves arising from C8? Actually, we have lower trunk which has been arised from C8 and T1, lower trunk. Okay, so the posterior branch from the lower trunk, it will be giving rise to posterior cord. The anterior branch will be giving rise to the medial cord. So now the C8 forms. So C8 forms lateral cord and part of lateral cord and posterior cord. So upper subscapular, this is thoracodorsal nerve, this is lower subscapular. So upper subscapular, thoracodorsal and lower subscapular will not be any of these nerves will not be supplying forearm. So let us look into the nerve which is supplying the forearm first of all. So let's look into axillary nerve and radial nerve. We'll come to know whether axillary nerve will be not supplying forearm, radial nerve will be supplying the muscles of the forearm. Okay. Medial pectoral nerve, it will be not supplying the muscle of the forearm. Medial cutaneous nerve of forearm will not be supplying the muscle of forearm. Middle cutaneous nerve of forearm, yes, it supplies the forearm. Medial root of median nerve, it will not supply the muscle of forearm. Median nerve, it will be supplying the muscles of forearm. So let us look into axillary nerve, radial nerve, median nerve, and at last I forgot to tell the ulnar nerve, which is a branch of medial cord. Ulnar nerve is a branch of medial cord. So first let's look into the major nerves of the forearm. Let's eliminate axillary nerve. Let's see about radial nerve, median nerve, and ulnar nerve, and then medial cutaneous nerve of forearm. And let's see where it supplies. Then we'll find what is the reason. We'll find which of the following will be affected. We have to find whether extensors of wrist and fingers are affected or flexors of wrist and fingers, small muscles of the hand, or supinatus. Let's look into the nerves and find the correct answer. The main cord which is coming out of C8 and T1 is medial cord. In the medial cord, median nerve is the major nerve. So this median nerve will be affected. If median nerve is affected, so the median nerve is nothing but the major nerve which will be supplying the flexors of the wrist and fingers. Since wrist joint, actually the patient will not be even able to move the wrist joint also, because the flexors of the wrist and fingers, it is supplied by the median nerve. So since it is affected, the patient, since median nerve is affected, flexors of wrist and fingers are also affected. Let's see how the median nerve goes. It is brachial artery, then biceps near the forearm, it supplies to pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, which are the superficial muscles, superficial flexor muscles. Flexor carpi anterior interstitial nerve will be supplying flexor pollicis longus, flexor digitorum profundus, pronator caudatus, which are deep muscles. It also supplies opponens pollicis, flexor pollicis brevis, abductor pollicis brevis on the radial side of the hand, and to the first and second lumbrical and palmar digital branches, lateral third, including their nail buds, it will be supplying. First and second lumbricals are also supplied. Abductor pollicis brevis, all those brevis and pollicis muscle. This is So it is flexors of wrist and fingers. Extensors of wrist and fingers are supplied by radial nerve.